My name is Hannah Moon. I'm a nurse practitioner for Bluepoint Medical Associates, and I see sleep consultations. Insomnia is difficulty initiating or maintaining sleep despite adequate opportunity, leading to daytime impairment. So at Bluepoint Medical, we take detailed history regarding your sleep hygiene and the hours that you sleep in the weekdays and the weekends. We assess how long it takes for you to initiate sleep, how long it takes for you to fall asleep, how long you're sleeping for, how often you wake up in the middle of the night, and for each of those arousals, how long are you up for, and what is causing those arousals. We also assess how early you wake up despite trying to sleep. There are two types of insomnia. One is acute and the second is chronic. Acute is easy to identify. There's a specific trigger or stressor. For example, you've lost a loved one, you've lost a job, or something has happened, like a trauma. Chronic is when you have insomnia symptoms at least 3 times a week for 3 months or longer. It's usually harder to identify the causes of chronic insomnia. So there are 2 causes of insomnia, primary and secondary. Primary is usually related to poor sleep hygiene behaviors. For example, they're looking at the clock when they wake up in the middle of the night. Some patients exercise too late in the evening, very close to their bedtime, having a separate or inconsistent schedule for weekday and weeknight. People are drinking caffeine way too late in the afternoon. They don't realize that the caffeine stays in your body for about 8 hours or longer. Secondary insomnia is when the cause is related to another health problem. For example, restless leg syndrome, in which you're moving your legs while you're awake. Periodic limb movement syndrome, when you're moving your legs when you're sleeping. Having acid reflux that's not controlled, asthma that's not controlled. It's also related to mood disorders such as anxiety or depression. Sometimes the thyroid level, whether it's low or high, it can affect the quality of your sleep. Or even pain such as fibromyalgia. All these are comorbidities that can affect your sleep. Many people start to drink alcohol because it helps them fall asleep, but alcohol abuse and drug abuse will also cause secondary insomnia. Often people start to drink because it helps them relax and fall asleep, but they'll quickly learn that when the alcohol wears off, it actually causes arousal. There are certain medications that are associated with insomnia. The medication can cause insomnia or make it worse. Some of the medications that are known to affect your sleep are depression medications in the SSRI class, blood pressure medications in the beta blocker class, decongestants such as cold medicine or allergy medicine purchased over the counter, or any kind of steroid. They all affect your quality of sleep. At Bluepoint Medical, we focus most on behavior modifications. We try to identify any poor sleep hygienes that you've been practicing over the years. When medically indicated, we order overnight sleep studies to rule out any organic disorders such as breathing disorder or leg movement. We sometimes refer patients for cognitive therapy to manage anxiety and depression that may have been undiagnosed. When necessary, we have the options of using sleep aids, medications to help you fall asleep or stay asleep. We'll prescribe the medications depending on your symptom. For patients looking for alternative therapy rather than relying on medications alone, we now offer electrotherapy in the treatment of anxiety, depression, and insomnia. It can be used alone or as adjunct therapy to sleep aid.